Hey guys, I realized I haven't really done a video in shit, like almost 6 months. So I did have top surgery, and so far things have been healing really well. I am talking to my doctor in a couple of weeks, or my surgeon rather, to see if I can possibly get a revision. It's not that I'm not happy with my results, because I am, especially from where I started from, but I do still feel a bit dysphoria with trying to wear shirts that are a little bit, I guess, a little bit clingier towards my chest. I was relatively like decent size before, and the type of surgery that I had is one that I really wanted, and I do feel that it did work out really well. It's just when you're doing that kind of surgery, you can't always guesstimate or estimate how much you're taking out, and then sometimes you leave a little bit more just in case. And I do feel like my surgeon maybe left a little bit too much than I wanted, and so I still kind of get like this like boobish effect that I'm not really pleased about. And I still wear my binder occasionally when I'm wearing certain types of t-shirts that I don't feel comfortable wearing without a binder. But for the most part, like, I am very pleased with my results, and I do feel a lot more comfortable. It's just, I think possibly getting a revision would make me feel more comfortable. And I think my surgeon made a really good point if he really wanted me to like build up those pec muscles. But unfortunately, with my work and school schedule, I just really honestly don't have the energy to work out as well as keep up on my coursework and all of my work duties. So I'm talking with him, I think, on like the 19th of October to see if I can go in for a revision and see if they can just take more of the tissue out. But overall, I am really pleased with it, and I did heal quite well. I just find that it's still not quite to what I was expecting, and it still kind of limits what I feel comfortable wearing versus what I should be able to wear. I haven't really been shirtless that much since surgery, and I would like to be more. So we'll see what he says. He said that he would do a revision within a year, and I got my surgery in May. So I'm hoping by then that we can maybe schedule something, or maybe if I just suck it up and do more muscle like exercises, that maybe I'll be more pleased with my results. I don't really feel comfortable like showing my chest at all. I was really stoked like the first month or so afterwards, and then I kind of just, the like dysphoria and the anxiety of having my chest there, it kind of took away the fun of having surgery. My recovery wasn't that bad though. I think I only took like a week off work, and then I went back to work on like really light duties. But I also think there was an instance where we had an order, and then someone who was supposed to come and help me with the order didn't show up, so I ended up having to do the order on my own. And this is like a beer order, so they're not exactly light, and the repetitive movement wasn't very good for my chest either. So it could be that possibly like the reason why I'm not as happy with my chest is because I didn't follow the aftercare instructions as closely as I should have. But at the same time, in that instance, I didn't really have much of a choice other than to put the order away and risk my chest being not the greatest. And I have been noticing, like, especially on the sides of my chest, I still have like quite a bit of scar tissue built up, and it's still like really sore. I don't know how else to explain it, but like the one thing I was not expecting after top surgery is that my like nipples get like really sensitive and really dry because they just like rub on everything, and that was not really something that anyone prepared me for. So I will warn you, it hurts. Luckily I didn't get grafts or anything, because with the way that my chest was before, I didn't really feel like I needed them, and where they sit now is like actually pretty normal, and I do think overall my chest kind of works with my body type. It's just I would like them to not necessarily look like my body type. It's mainly just kind of like the underside is still kind of fatty, and like when I lean over I feel really self-conscious because they still kind of, I don't really know how to explain it, like they're kind of just like, they just kind of look like they used to, and that makes me really uncomfortable for any time I have to like bend over to pick up something or anything like that. Like I just feel extremely anxious, and it just, like, I know that I pass okay without it. It's just I would feel a lot more comfortable if it was fixed. So we'll see what he says. I'm really hoping he's willing to work with me, even though I haven't been building up as much like chest muscles as I would like. But also it kind of makes it difficult to like do push-ups and sit-ups and that kind of thing when you have a lower back injury. So I guess we'll see. But I would definitely recommend my surgeon to anyone who wanted that kind of surgery and didn't want to go through Alberta Healthcare, because I do think like him and his staff are absolutely fantastic, and like, you know, they were very trans friendly. They do a lot of trans related surgeries, so, or at least chest surgeries. My surgeon doesn't do any sort of bottom surgery, but you know, like they use the right pronouns. Like my mom came with me. My recovery was pretty easy. My stitches actually are underneath my nipple, so it's kind of like a periola or periareola surgery. So I just have like this little moon scar underneath the bottom part of my nipple. So it's really not noticeable at all, which is great. And my incisions, one side I think cleared up on like 2 weeks after, and then the other one was like 3 weeks. So they were saying like 4 to 6 weeks for them to dissolve, and mine dissolved a lot quicker. The compression vest was not a fun experience though, and that's definitely something that I thought was going to be like kind of easy, but because I have a lower back injury, like the extra pressure on my chest and my rib cage kind of went down into my back, and it made it really uncomfortable to sleep, and I was just really grumpy for the first couple of weeks because I could kind of sleep on my side, but when I slept on my side the compression wasn't as good, so that could also be why I don't necessarily have the results that I wanted. That's kind of all I had to say about it.